My name is Dr. Timothy Beck. I'm a foot and ankle orthopedic specialist with Azalea Orthopedics. Common injuries that we treat in my practice are foot and ankle injuries, ankle sprains, which is where ligament that supports the ankle is torn, usually causing looseness in the ankle, and that needs to be addressed usually with a brace or a boot or a cast. Common injuries of the foot are fractures and sprains also. Sometimes these require surgery if we can't, if they're displaced or if they're not able to be treated non-operatively. And surgery can be done to line the bones back up or repair the ligaments and make it where the foot and ankle should stop hurting. Most sprains will heal by themselves. It just has to be treated the right way. We have to get the stability to the joint restored, and that's usually done with either a cast or a brace or a boot. And it has to be used appropriately so that the ligaments tighten up, and they will do that on their own if it's treated the right way. Sometimes the ankle ligaments will not tighten up on their own, and those do require surgical reconstruction to provide stability to the ankle. Another very common thing that we see in our practice is ankle fractures. Usually occurs from a twisting injury where either one side or both sides of the ankle have a fracture. A lot of the fractures on the outside part of the ankle, which is the lateral malleolus, don't have to have surgery. Some do, but if you break both sides of the ankle, or even sometimes all, three sides of the ankle, those typically do require surgery to put the bones back in place and stabilize them. Most ankle fractures that require surgery, we use a plate on the outside bone on the lateral malleolus, and if the inside bone is broken, we usually fix that with screws. Fractures around the ankle typically take about 10 to 12 weeks to heal, so during that time, usually the patients aren't able to put weight on their foot for part of that time, and then as they get farther along and there's some healing, we do allow the weight bearing to occur. Arthritis in the foot and the ankle are also fairly common. They're usually post-traumatic in the ankle from an injury, a break, or repetitive sprains that didn't ever get taken care of the right way. Ankle arthritis is fairly common, and the two options that patients have for ankle arthritis, if conservative measures have failed, is either an ankle replacement or an ankle fusion. The replacements are really a great procedure for the right patients because it preserves the motion and allows them to get back to doing most of everything they did before they developed the arthritis pain. The ankle fusion is still a very good surgery. It relieves the patient's pain, but they do lose the motion at the joint at the expense of getting rid of the pain.